and I am happy to stay for a second round if any senator has any remaining questions. Before we begin, I want to walk through the COVID-19 safety protocols in place. We will follow the advice of the attending physician and the sergeant at arms in conducting this hearing. We are all very grateful to everyone who has worked so hard to get this set up and help everyone stay safe and healthy. Committee members are seated at least 6 feet apart, and some senators, including myself, are participating by video conference. And while we are unable to have the hearing open to the public or media for in-person attendance, live video is available on our committee website at www.help.senate.gov. We received Dr. Murthy's formal nomination on January 20th, and his committee paperwork and his Office of Government Ethics paperwork, including his public financial disclosures and ethics agreement, on February 3rd. And we received Dr. Levine's formal nomination on February 13th, committee paperwork on February 10th, and her Office of Government Ethics paperwork on February 17th. Dr. Murthy, Dr. Levine, thank
Patty,
you.
can you hold for 1 second?
Sure.
They're working on getting you unmuted, and your video went away for just a second. So if you will, let us make sure that we've got you back before you continue.
Well, thank you.
Never know which side we're supposed to be on.
Can you hear me yet? Okay, fine.
We can hear you.
Okay, great. And I'm not sure where you lost me.
If you back up about 2 sentences, I think you'll have us.
Okay. Well, let me just say we received Dr. Levine's formal nomination on February 13th and committee paperwork on February 10th, and her Office of Government Ethics paperwork on February 17th. Dr. Murthy, Dr. Levine, thank you both for joining us today. While I have not been able to meet either of you in person since your nomination, I was pleased to speak with each of you about the challenges our nation is facing, and I look forward to continuing those conversations today and working with you both in the future, remotely for now, when it works, and in person when this pandemic is over. Of course, in order to end this pandemic and rebuild our nation stronger and fairer, the Biden administration needs an all hands on deck as soon as possible, which is why it is so important this committee move quickly to consider and confirm qualified nominees like Dr. Murthy and Dr. Levine. We have lost over 500,000 people to this pandemic, to say nothing of the countless other ways it has upended the lives of families across our country. We desperately need trusted public health experts who can debunk misinformation and rumors, promote public health guidance on mask wearing, social distancing, and more, and encourage vaccinations and inform people about vaccine safety and efficacy. We desperately need leaders who understand what our communities are going through and who will go above and beyond to help our states, cities, and tribes get the support they need. In other words, we need people like Dr. Murthy and Dr. Levine. Dr. Murthy is a crisis-tested leader who is uniquely qualified to help the American people navigate the health challenges ahead of us. I'll say more about his impressive record shortly, but one of the reasons I know Dr. Murthy is the right pick to serve as Surgeon General is because he's already done the job and done it well. During his last tenure as America's doctor, he established himself as a trusted voice on public health issues, saw our nation through public health emergencies like the Zika epidemic in 2016. He led the charge against the opioid crisis, and he shined a light on how stress, isolation, and other mental health issues threaten America's well-being, an issue that is all the more urgent given the trauma of this pandemic. In short, he proved why he's exactly the kind of leader we need as Surgeon General today. I was proud to vote to confirm him as Surgeon General back in 2014. I'm proud to support his nomination to return to that role now, and I'm hopeful my colleagues will join me in working to get him in place quickly. I'm also proud to support the nomination of Dr. Levine, who is a highly qualified and historic choice to serve as Assistant Secretary for Health. I've always said our government should represent the people it serves, and the nomination of Dr. Levine, who would make history as the highest ranking openly transgender official in the US government, brings us a step closer in making sure that that happens. Dr. Levine is a public health expert who has a firsthand understanding of the challenges our states are facing and the support they need. As the highest ranking health official in Pennsylvania, Dr. Levine led the state's COVID-19 response and advocated for resources and support Pennsylvanians needed. She focused on transparency and clear science-based communication throughout the response and gave daily briefings on the status of the epidemic. But even before this crisis, Dr. Levine established herself as a trusted voice to the people of Pennsylvania on matters of public health through her work to establish opioid prescribing guidelines and education for medical students, make life-saving treatment for opioid overdoses widely available, combat eating disorders, increase health equity, and help the LGBTQ community get health care. She served the state as physician general, a position the Republican-led state Senate confirmed her to unanimously, and then as the state secretary of health, a position she was confirmed to by an overwhelming 49-1 margin. Given her clear qualifications and the urgency of this crisis, I hope she will have similar bipartisan support here. Because a pandemic isn't the time to focus on politics, we need to focus on getting people reliable information from expert voices that they trust, getting states, tribes, and communities the resources and support that they need, getting testing and tracing and vaccinations up, and bringing new cases down. We need to focus on providing mental health care as the nation grapples with the trauma of this pandemic, and on eliminating inequities that existed long before this crisis, have grown worse during it, and have the pandemic so much more deadly for communities of color. We all know this pandemic is not going to be stopped by partisan politics. It's going to be stopped by swift action and by public health experts like Dr. Murthy and Dr. Levine. So I hope we can come together to confirm them in quick bipartisan fashion and work with them the way families across the country so desperately need us to. Finally, I seek unanimous consent to put in the record 29 letters in support of Dr. Murthy's nomination, 51 letters in support of Dr. Levine's nomination, and from hundreds of hospitals, public health groups, patient advocates, medical schools and universities, LGBTQ advocacy groups and clinicians, faith-based and medical organizations, reproductive rights and family planning groups, civil rights groups, and so much more. So ordered. And with that, I will recognize Ranking Member Burr for his opening remarks.
Well, thank you, Madam Chairman, for the opportunity to provide remarks as the committee reviews the qualifications for two critical public health positions at HHS, the Assistant Secretary for Health and the Surgeon General. Dr. Levine, welcome, and Dr. Murthy, welcome as well. I also want to reinforce the chairman's words that we all seek bipartisan votes on nominees. But that doesn't mean that answers to questions don't have to be sufficient. Today is your opportunity for that. Each of you have accepted a nomination at an important time when our country is facing one of the most challenging times in our history as we combat COVID-19. I have no doubt that should you be confirmed to these important leadership roles, the majority of your time will be focused on responding to the novel coronavirus and its impact. As Assistant Secretary of Health, Dr. Levine, you'd be in charge of a range of health issues, including human research protections and research integrity. As Surgeon General, Dr. Murthy, you'd be responsible for providing Americans with the best scientific information and overseeing the Public Health Service Commission Corps, both of which continue to be critical to our pandemic response. The question before us today is, are both of you prepared and qualified to take on the roles and responsibilities required? In addition to the challenges that face us today with pandemic, this hearing will help answer those questions, but I'm very concerned about a nomination that's not before us today. In fact, it hasn't yet been made by the administration. The Assistant Secretary of Preparedness and Response, or ASPR for short, is the top advisor to the Secretary of HHS during public health emergencies. Congress created ASPR to serve in a dedicated role that coordinates among all the operating divisions and agencies within HHS, including the Assistant Secretary of Health and the Surgeon General. We have before us nominees for both Assistant Secretary for Health and Surgeon General, but not the coordinator, the ASPR. While the words of this administration claim urgency in their response to COVID-19, their actions or lack thereof speak otherwise. The law calls for strong leadership during pandemic health emergencies, but the nominations before us, while important, do not fill the role of the department charged with leading an emergency response. The administration claimed to be ready on day one, and the fact that a nominee for the ASPR hasn't yet been made and no meaningful effort at consultation with Congress about filling the position, quite frankly, raises serious questions. The ASPR is directed to communicate information from across the department to the Secretary, bringing a daily vigilance and constant urgency to the healthcare needs of the American people so that the Secretary can make informed decisions both in the midst of public health crisis and in times of preparation for the next threat we will face. We've been grappling with the novel coronavirus public health emergency for over a year. The new administration has had ample time to choose an individual for this critical role. So it's difficult to understand why the ASPR nominee is not at least sitting here with the two of you, if not before your hearing. Since it is our responsibilities as members of Congress to vet two nominees before us, I'll try to understand the roles each of you will play at HHS during the COVID-19 pandemic and the qualifications and experiences you have to do so. Now, Dr. Levine, the position of Assistant Secretary of Health evolved during the pandemic under the previous administration, playing an integral role in the COVID-19 response. Dr. Giroir, and we've all struggled with exactly how to pronounce his name, but Dr. Giroir worked with NIH and BARDA as they partnered with innovators to develop and scale up testing technologies, helped to address shortages of testing supplies, and worked with states to meet its testing needs. Dr. Levine, you've been on the front line of the COVID-19 response in your home state of Pennsylvania, which faced great challenges with testing capacity early in the pandemic and vaccine rollout to this day. The state public health lab was only able to perform 6 tests per day in March of last year. 6. Severely limiting the public health response that relied on identifying where the state virus was spreading. Along with testing challenges from last spring, your state failed to adequately protect nursing home residents from the virus and is making unacceptable mistakes in the vaccine distribution process. Pennsylvania ranks as one of the most dangerous states for long-term care residents battling COVID-19. 52% of Pennsylvania's COVID-19 deaths came from nursing homes, and 3 in 10 of the deadliest facilities in the country were in Pennsylvania. Your state came in 46 in the country in its effort to put safeguards in place that manage the spread of infections in these settings, with only 16% of the state's nursing homes receiving infection control inspections that could have saved residents from the spread of COVID-19. While you stated that you relied on federal guidance for the nursing home care during the pandemic, the tragic high mortality rate in your state's nursing homes shows that more was needed but wasn't provided. In my state of North Carolina, our health secretary also relied on federal guidance for nursing homes and long-term care settings. In North Carolina, our nursing home mortality rate, while still high, accounts for 36% of the deaths in our state. This discrepancy clearly shows that hiding behind federal guidance is no excuse for taking action to protect our most vulnerable. I look forward to understanding exactly why your decisions, when relying on the same federal guidelines as my state, resulted in a different outcome for Pennsylvania's seniors. In regards to vaccine rollout, reports from your state recently indicated that tens of thousands of Pennsylvania residents mistakenly received the dedicated second dose of Moderna vaccine, meaning second dose that was reserved for those who had had a first dose, and the second dose went to newly vaccinated people. While you may not have been in office during the last few weeks of the challenges facing your state, you were serving as the state's health secretary during the development and submission of its COVID-19 vaccine plan last October. And I might note that yesterday in the Help Committee, Senator Marshall put into the record, I believe, 50 state plans that had been submitted. And I think it's important that we understand that you cannot separate your role from the performance of your agency a matter of weeks after your departure. So I hope you will take those questions on seriously. At each step, testing, treatment, and now vaccination, your state's response has fallen short. As the state's health secretary, this track record reflects on your ability to meet the challenges that would come across your desk immediately should you be confirmed. I'm sure we will find similar problems in all 50 states, and similar blame could be leveled on Congress. But you're the nominee, and I hope you will address those questions as best you can. Dr. Murthy, earlier this week, you and I had an opportunity to discuss a range of issues, and I'm thankful for that time, as I did with Dr. Levine, that the Surgeon General will face in this administration, starting with the response to COVID. You've already served once as the nation's doctor, and my friend from Kentucky often tells us in the conference, not much education comes out of the second kick of a mule. So I hope to learn more about why you want to do this again. Should you be confirmed, the American people will be placing their trust in you to communicate without political preference or pressure the best ways to keep their families safe during the crisis. I worry about your ability to separate political influence from your ability to communicate healthcare decisions. In fact, you spoke at the Democrat National Convention, a wholly political event, just a few months ago. As a co-chair of the transition team's coronavirus task force, you said that the president's goal of 100 million vaccinations by 100 days was doable, lowering expectations for an accomplishment well within our reach today. Before President Biden took office, our country was already vaccinating 900,000 people a day and had administered over 20 million shots. I'm in politics, so I know lots of people try to lower expectations in order to look like they're accomplishing something when they're simply showing up. But the Surgeon General has to be trusted for the facts. 100 million people in 100 days isn't a stretch goal. And you shouldn't be afraid to stand up to the political staff who want you to lower the expectations so the administration can easily reach them. The American people deserve a Surgeon General who will separate fact from fiction and level with us on the science. Madam Chairman, in conclusion, Dr. Levine and Dr. Murthy, the actions and positions that they've taken prior to your nomination in the process leave me to have some concerns. I hope that you'll use today's hearing to address those concerns to earn my support. The position of Assistant Secretary of Health and Surgeon General are important and must be filled. But it is frustrating that the administration chose to prioritize the nomination of candidates for these positions, as important as they are, instead of the nomination of the leader for federal government's response to pandemics that is required by law. Strong leadership will continue to be absolutely necessary throughout this phase of pandemic response. And I'll use my time today to get an answer to the questions, or the question, who's in charge? Chairman Murray, Dr. Levine's challenges in Pennsylvania to bring early adequate testing and to keep nursing home residents safe, and Dr. Murthy's inability to separate politics from good public health policy are especially concerning when the role of ASPR still stands vacant. I look forward to hearing their testimony today, their plans to navigate a response at HHS without a Senate-confirmed ASPR to provide the direction these two offices need during a challenging time. I thank both of our nominees for being here today. I yield back to the chair.
Thank you very much, Senator Ranking Member Byrd. We will now introduce today's witnesses. Dr. Vivek Murthy has a distinguished career that has solidified his reputation as a trusted public health expert. He has worked to improve the health of people across the country and across the world. And in doing so has shown beyond a doubt he is the right person to see us through this pandemic as Surgeon General. Before he was a doctor, before he was a public health expert, Dr. Murthy was a kid growing up in Miami, Florida, the son of 2 immigrants from India. He attended Harvard University for his undergraduate degree, Yale for both his MD and MBA, and completed his residency in internal medicine at Brigham and Women's Hospital and Harvard Medical School. His passion for public health was evident even as a freshman in college. That was when he co-founded Visions Worldwide, an organization focused on HIV/AIDS education in the US and India. And since then, he has only further demonstrated his ability to lead and his drive to help people stay healthy. He also co-founded the Swasthya Project, which empowered women with training to become healthcare providers in rural India. Trial Networks, a company that works to improve medical research and collaboration and data sharing. And Doctors for America, a group of over 18,000 doctors and medical students that advocate for quality, affordable healthcare. In 2011, President Obama tapped Dr. Murthy to serve on the advisory group on prevention, health promotion, and integrative and public health. And in 2013, he nominated Dr. Murthy to be Surgeon General. As America's doctor, he saw the nation through the Zika epidemic in 2016, released landmark reports on the opioid crisis and the dangers of e-cigarettes to youth, and led important discussions about mental health, something the trauma of this pandemic has made even more urgent. He also championed preventive health, including a memorable video he did with Elmo to help promote vaccines. Seems to me it's about time for us people. During this pandemic, he has been an important voice, urging people to follow public health guidance and keep themselves and others safe, and a key advisor to President Biden. He was a critical member of Biden's campaign's COVID-19 team and served as co-chair of the transition's coronavirus task force. Dr. Murthy is also the proud father of 2 children and the husband of Dr. Alice Chen, who is a physician as well and who is watching with us today. Dr. Chen, welcome to you. Dr. Murthy, we are so glad to have you with us today. Thank you for being here. And now I will turn it over to Senator Casey to introduce Dr. Levine.
Thank you, Chair Murray, for your introduction of Dr. Murthy. And I'm pleased to introduce Dr. Rachel Levine, the former Secretary of Health for Pennsylvania, also former Professor of Pediatrics and Psychiatry at Penn State University, and the immediate past president of the Association of State and Health Officials, and the nominee to serve, of course, as Assistant Secretary of Health at the Department of Health and Human Services. I've known Dr. Levine for years, thanks to her previous service as both Secretary of Health as well as the Physician General of Pennsylvania, a position that is comparable to that of our other distinguished nominee today, Dr. Murthy. In this terrible time of crisis for our country, when we have tragically lost over 500,000 people to this terrible disease, the need for expert, experienced, and fact-based as well as compassionate leadership could not be more critical. This is the type of leadership that Dr. Levine has demonstrated in Pennsylvania throughout the pandemic. Dr. Levine has strong roots in academics, clinical care, and protecting the most vulnerable among us. She has a distinguished career practicing pediatric and adolescent medicine in both New York and Pennsylvania, serving as Director of Pediatric Ambulatory Services and Adolescent Medicine at Penn State Hershey Medical Center, and she was the founding director of the Division of Adolescent Medicine and Eating Disorders. She is the author of numerous papers on opioids, adolescents, eating disorders, and LGBTQIA medicine. When COVID-19 came to our state, Dr. Levine's leadership was marked by clear, science-based communication at her daily briefings. Her early action, her collaborative style, and her calm were recognized by the medical community as well as leaders on both sides of the aisle. The COVID-19 pandemic response was not Dr. Levine's first experience with crisis management. She earned the praise of Pennsylvanians and the public health community for her comprehensive and strategic approach to address the opioid addiction crisis in our state. She changed addiction medical education and prescribing practices, and she made naloxone, the life-saving rescue medicine needed at the time of an overdose. She made it widely available to law enforcement, schools, and residents alike. She worked tirelessly to address health disparities, including Black maternal mortality and obstacles to access to care faced by the LGBTQ community. Dr. Levine has dedicated her career to children and young adults, addressing physical, mental, and social care needs. As Pennsylvania's Secretary of Health, she brought that approach to all residents, including our seniors and long-term care residents. As further evidence of her effectiveness and style of leadership, I would note that Dr. Levine was confirmed three times to her prior positions in state government by Pennsylvania's Republican majority state Senate. I'm grateful for her willingness to continue her distinguished career in public service, and I look forward to working with her in the role that I know she will be confirmed as Assistant Secretary of Health at the Department of Health and Human Services. Thank you, Chair Murray.
Well, thank you so much, Senator Casey. Dr. Murthy, Dr. Levine, we are looking forward to hearing from both of you now. And Dr. Murthy, you will begin with your testimony.
Thank you so much, Chair Murray. Chair Murray, Ranking Member Burr, distinguished members of the committee, I am deeply honored and incredibly grateful for the opportunity to appear before you today. I would like to first introduce my wife and my best friend, Dr. Alice Chen, who is sitting behind me. It is her love and support that has brightened each day of my life since we first met more than a decade ago. And while they weren't able to be here in person, I'm thinking today about the rest of my family who is watching from afar. My children, Tejas, who is 4, and Shanti, who is 3, my grandmother, Sarojini, my sister, Rashmi, and brother-in-law, Amit, and especially my parents, Hallegere and Maitreyi Murthy. They came to this country from India decades ago. They had few contacts or resources, but they had high hopes that America would be a place where their children would find education and opportunity. They set up a small medical practice in Miami, and as a child, I watched them make house calls in the middle of the night and wake up early to visit patients in the hospital before heading in to their office. They attended birthdays, weddings, and funerals for their patients, always there in the moments that mattered because they saw their patients as family, and that is what you do for family. I have tried to live by the lessons that they embodied, that we have an obligation to help each other whenever we can, to alleviate suffering wherever we find it, and to give back to this country that made our lives, my life, and the lives of my children possible. This is a moment of tremendous suffering for our nation. More than 500,000 people have lost their lives to COVID-19, including beloved members of my own family. Many more are facing long-term health consequences and stressful financial struggles. If confirmed as Surgeon General, my highest priority will be to help end this pandemic. In the work I've done over the past year with government leaders and schools and businesses and healthcare providers, I've seen the importance of providing clear science-based guidance to Americans on how to protect themselves and others. And I know how urgent it is that we communicate clearly about the safety and effectiveness of vaccines and get them to people as quickly as possible, particularly those in underserved rural communities and communities of color. But as we address COVID-19, we cannot neglect the other public health crises that have been exacerbated by this pandemic, particularly the opioid epidemic, mental illness, and racial and geographic health inequities. I have witnessed how these challenges are destroying lives and devastating families all across America. During my prior service as Surgeon General, I listened to and learned from people in rural communities in Oklahoma and Alaska, and in big cities, including Indianapolis, New Orleans, and Charlotte. Their stories are what led me to issue the first Surgeon General's report on alcohol, drugs, and health, and to launch a national education campaign on opioids and safe prescribing. But we have so much more to do. And if confirmed, I will work tirelessly to address these crises. I will do so guided always by the very best science. And I will work with Secretary-designate Becerra, Dr. Levine, and with colleagues across the federal government and its state and local levels. Equally as important, though, I will also work closely with community partners, from faith leaders and businesses to doctors, nurses, and educators. I would also welcome, once again, the chance to work hand in hand with congressional leaders on both sides of the aisle, as I was privileged to do in the past, as we together addressed the opioid epidemic, the Zika virus, and other public health challenges. And I would be honored, deeply honored, to once again lead the United States Public Health Service Commission Corps, which for more than a century has helped our nation respond to public health threats, including COVID-19. Senators, I know that the challenges before us are daunting, but if confirmed, I will never forget that at its essence, the role of the Surgeon General is that of a doctor, one charged with serving every single American. I learned as a doctor to approach each patient with both head and heart, with science and compassion, recognizing that both have the power to heal. I learned to respect the uniqueness of each patient, recognizing that solutions must be tailored to each individual. And I learned to listen deeply to the patient in front of me, to look beyond any labels, and to see that person in their fullest humanity, knowing that they were someone's mother, father, grandparent, child, sibling, and friend. The most important job of a doctor is to help patients heal. And if confirmed, that will be my mission as Surgeon General, to do whatever I can for as long as I can to help our communities and our nation heal. Thank you so much for your consideration of my nomination, and I look forward to your questions.
Thank you very much, Dr. Murthy, and we will now turn to Dr. Levine for your testimony.
Chairwoman Murray, Ranking Member Burr, distinguished members of the committee, thank you for the opportunity to appear before you today.
Can we make sure the mic's on? Thank you.
I am honored to be President Biden's nominee to serve as the Assistant Secretary for Health at the Department of Health and Human Services. If I am fortunate enough to be confirmed, I look forward to working with Secretary-designate Becerra, Dr. Murthy, and with each of you in service to our country. At its core, my career has been about helping people live healthy lives. As the Assistant Secretary for Health, I would be committed each day to helping the people of our nation and improving our public health. I am both humbled by the opportunity and ready for the job. As you know well, we each come to public service in our own unique way. In my case, I was a physician for many years, specializing in pediatrics and adolescent medicine, and managing educational and departmental responsibilities at a major academic hospital system. Throughout my medical career, I have been particularly invested in health issues that are at the intersection of physical and behavioral health, and I brought that expertise to public health in addressing substance use disorders. After receiving my education at Harvard College and the Tulane University School of Medicine, I trained at the Mount Sinai Medical Center in New York City. I practiced pediatrics and adolescent medicine at Mount Sinai and Lenox Hill hospitals. Then I moved to Pennsylvania and worked at the Penn State College of Medicine and the Penn State Hershey Medical Center. At Penn State, I initiated a division of adolescent medicine for the care of complex teens with medical and psychological problems. And in addition, I started the Penn State Hershey Eating Disorders Program, which offers multidisciplinary treatment for children, adolescents, and adults with eating disorders. When I left Penn State Hershey in 2015, I was professor of pediatrics and psychiatry, vice chair of pediatrics for clinical affairs, and the chief of the Division of Adolescent Medicine and Eating Disorders. In 2015, I was named by Governor Tom Wolf to be the Physician General for the Commonwealth of Pennsylvania and confirmed unanimously to the post by the State Senate. I was confirmed twice more on a bipartisan basis to be Secretary of Health. In both roles, I concentrated on addressing the opioid misuse and overdose crisis in our state, working in partnership with the Federal Department of Health and Human Services on these efforts. We focused on opioid stewardship, meaning the safe, appropriate, and responsible prescribing of opioids. We taught those practices to medical students. In addition, we developed continuing medical education programs. We established prescribing guidelines, as well as a robust prescription drug monitoring program as part of our efforts. One of my most significant accomplishments as Physician General was signing the first ever statewide standing order for the distribution of the life-saving medicine naloxone. This enabled emergency medical personnel to carry naloxone to reverse overdoses, as well as the public to readily access the medication, saving thousands of lives as a result. As Secretary of Health through the Pennsylvania Rural Health Model, we work to save rural hospitals by transitioning them from fee-for-service to global budget payments. This model aligned incentives for providers to deliver value-based care and for rural hospitals to transform their care to better meet community health needs. In addition, we established a maternal mortality review committee to better understand and respond to the causes of maternal deaths, and we work to improve childhood immunization rates as well as other priorities. Of course, our focus changed dramatically last year, and COVID-19 became my most urgent and primary focus. We concentrated on 3 key priorities to combat COVID-19: containment, with expansion of testing and contact tracing; mitigation, with masks and social distancing; and medical countermeasures, such as the distribution of medications, such as monoclonal antibodies, and of course, authorized vaccines. As part of these efforts, we created a health equity task force, which included many community stakeholders, such as the Pittsburgh-based Black Coalition Against COVID-19 and the Latino Connection. We also launched a faith-based testing strategy where people could get tested at their places of worship. There is still so much more to do. If confirmed, I will continue focusing on these issues at HHS to work to get the pandemic under control. I look forward to driving efforts and oversight within the Office of the Assistant Secretary for Health that will bolster the health of our nation. I look forward to your consideration, and I humbly ask for your support. And I look forward to your questions.
Thank you very much to both of you. We will now begin a round of 5-minute questions, and I do ask my colleagues to please keep track of your clock and stay within those 5 minutes. I am happy to stay if any of you have additional questions for a second round. The United States is in the midst of the worst pandemic we have ever seen in over a century, and the previous administration's response to this pandemic was marked by the rejection of science, dissemination of misinformation, and the erosion of trust in our scientific agencies. And as we mark over 500,000 people dead in this country, it goes without saying the toll has been profound. Under President Biden's leadership, we now have a science-led, coordinated national response. In the past month, we've already seen significant increases in testing and tracing and vaccination, and we've seen downward trends in the number of new cases, hospitalizations, and deaths. But there is a lot of work ahead to keep families safe, get everybody vaccinated, and fight misinformation with reliable public health guidance. And we need to address troubling reports about people choosing not to get vaccinated by having trusted public health experts and trusted partners communicating with the American public about these issues. Dr. Murthy, one of the important roles of Surgeon General is being a clear and prominent voice on the importance of science. If confirmed in this role, how will you promote confidence in our scientific agencies and in COVID-19 vaccines?
Well, thank you, Chair Murray, for that question. I think it's absolutely for sure that the central job of the Surgeon General has to be to communicate in a way that is driven by science. And one of the great challenges during this past pandemic, and that's ongoing, is that we have been responding to the virus while we've also had to learn about the virus. And as our knowledge has changed, it hasn't always been easy to communicate clearly with the public about those changes. But my goal, if I was confirmed to serve as Senator, would be, number one, to first and foremost work with the CDC, with the NIH, and other scientific entities in government to make sure we are clear on what the science says, to go out to where people are and communicate that information clearly, including communicating why we change our recommendations if we do make changes. But I think perhaps most importantly, Senator, I think public education actually starts not with speaking, but with listening. And I think that, as I can say this for myself and perhaps for all the roles that I've played, that I have learned far more by listening to the people that I have sought to serve than I have by listening to by reading textbooks. Understanding their concerns, their needs, understanding how they interpret information can help us do better as public servants and public educators. And that would be the approach I would seek to take if I had the privilege of serving.
Okay, thank you. Dr. Levine, in your role as Pennsylvania Secretary of Health, you worked closely with experts throughout the state on your COVID-19 response. How will that experience inform your efforts to work with state, local, and tribal public health and community leaders if you are confirmed as Assistant Secretary for Health?
Well, Senator, thank you so much for that question. I certainly, if confirmed to this position, look forward to working with the administration, the CDC, Health and Human Services on President Biden's strategic response to the COVID-19 pandemic. I feel that I have a unique perspective on the COVID-19 pandemic working as a state health official in Pennsylvania, in addition to my work as the president of ASTO, the Association of State and Territory Health Officials. I know firsthand the importance of the collaboration and coordination between federal public health officials, state public health officials, and local public health officials. And if confirmed, I look forward to working with the Biden administration and others on coordinating our response.
Thank you. The COVID-19 pandemic has really been a painful reminder that deep health inequities remain entrenched in our society, driven by structural racism, discrimination, and bias. From the beginning, this pandemic has taken a disproportionate, deadly toll on people of color, which is entirely unacceptable. In addition to centering equity in our COVID-19 response, we have to commit ourselves to the hard work of building a more equitable healthcare system. All people, including families of color, people from low-income backgrounds, underserved areas, LGBTQ people, people with disabilities, and others need to be able to get high-quality, affordable care. I am out of time, but Dr. Murthy and Dr. Levine, I know that is a priority we share, we've talked about, and I want you to know I look forward to working together to make sure health equity is incorporated in the COVID-19 response and all of HHS's public health work. So thank you again for being here. I will have more questions in the second round, but I will turn it over to Senator Burr for his questions.
Thank you, Madam Chairman. Dr. Levine, as I mentioned in my opening statement, your state continues to struggle with COVID-19 response. How can you assure that the same challenges that Pennsylvania experienced in testing, nursing home care, and now vaccinations will not occur when given the opportunity to serve in the public health policy area?
Well, Senator, thank you for that question and the opportunity to respond. In Pennsylvania, we did work to have a scientific evidence-based response to COVID-19. There were significant challenges. This is a novel coronavirus, and especially in the spring, we had challenges with testing. We had challenges with contact tracing, et cetera. We had a lack of personal protective equipment, as most other states did that were impacted in the spring. I think that the nation's response has improved significantly, and under President Biden's leadership and his strategic plan and task force, if confirmed, I look forward to my role in the nation's response. I look forward, as I mentioned, to collaborating with local, state, as well as federal officials and working on that coordination and communication.
Over the past few years, the National Institute of Health has been investigating cases involving NIH-supported researchers who have failed to disclose support from foreign governments and other entities, who have diverted intellectual property through grant applications and other NIH-funded projects, or who have sought to influence or undermine the peer review process. The Office of Assistant Secretary for Health oversees the Office of Research Integrity. If confirmed, how will you seek to address attempts by foreign governments to influence U.S.-funded research?
Well, Senator, thank you for that question. If I am fortunate enough to be confirmed as the Assistant Secretary of Health and oversee, as you mentioned, the Office of Research Integrity, I certainly commit to working with you, to working with Congress, with other experts at Health and Human Services and NIH to make sure that research standards are of the highest quality and that there is no interference in research in the United States.
Dr. Murthy, vaccine hesitancy is not limited to COVID. The 2019 measles outbreak, there were 1,282 cases reported in 31 states. And it shows that vaccine hesitancy is a growing problem for other conditions as well. Given your previous participation in politics and controversial policy debates, will you be able to effectively communicate the safety and efficacy of vaccines to those Americans who may not agree with your policy or your political views?
Well, thank you, Senator, for that question. Senator, I approach issues like vaccines and all public health issues first and foremost as a doctor. I was taught in medical school that it doesn't matter what someone's background is, doesn't matter what their race and ethnicity is, doesn't matter certainly what their political affiliation is. Each person is a human life that has unique value, and we have to treat them with dignity and respect. And that's how I approached my job when I had the privilege of serving last time, Senator. With regard to the measles outbreak, my approach then in talking about vaccines was to start by listening to what people's concerns were, not to demonize them or castigate them for their stance, but rather to understand what their concerns are. Second, it's to bring the best of science so that people can understand what the data actually tells us about these vaccines, what we know, but also to be honest about what we don't know. And lastly, sir, I believe it's important also to recognize that the Surgeon General is an important messenger, but not just directly in speaking to the American people, but in engaging with partners, in mobilizing trusted voices, including faith leaders and doctors and nurses in local communities. And that convening role is also important to Surgeon General. It's what I used certainly when I was building a national opioid campaign to work on changing prescribing practices. That approach of partnerships is what I would incorporate if I was working on a vaccine hesitancy strategy today.
I'm curious, throughout the last year, the Surgeon General frequently communicated with the American people the best ways to keep families safe and healthy during a difficult time. How do you think the role of Surgeon General differs today from when you previously held that role?
Well, Senator, it's a great question. And I think it's especially important because I think the country is evolving and it's changing and people's needs are evolving, and the Surgeon General's role has to evolve accordingly. You know, when I was, there's some things that are similar to when I served last time, some things that are different. I think, you know, we have ongoing concerns around vaccine hesitancy, but I think that they are more complex and nuanced now than they were pre-pandemic. I think that the fragmentation in how people get their information is even greater now than it was 7 years ago, with people not just getting their information from a couple of sources or a couple of social media platforms, but getting it from a wide variety of sources. To me, that increases the importance of us engaging with local partners who can speak to and access people where they are, as opposed to solely trying to, as individuals in government, get on a few platforms or news sources and assume that we're going to reach everyone. So that partnership strategy, the convening role of the Surgeon General, I think is even more important now than it was when I served in the last time.
Thank you for that. Thank you, Chairman Murray.
Thank you, Senator Burr. Senator Casey.
Chair Murray, thank you very much. I have a question for Dr. Levine and one for Dr. Murthy. I'll start with Dr. Levine. Two issues relating to children. One is mental health and the other is child abuse. 1 in 5 children have, before the pandemic, suffered from mental health issues, and rates of anxiety and depression have doubled since the pandemic. It's hard to comprehend the scale of that. In fact, mental health issues now account for 30% of emergency room visits for high school and middle school students. 30% of emergency room visits. Over half of young adults report symptoms of anxiety and depression. That's mental health. Then we go to the horror, the American scourge of child abuse, frankly, that neither party has done enough to combat. Child abuse is on the rise, we know that, and yet without the contact provided through in-person school, many more cases are going undetected. With all of these terrible stressors that are burdening our children, it's more important than ever that we focus on children's health and behavioral health needs. Dr. Levine, given the depth of your experience in addressing quality and access to mental health services, can we be assured that these issues will be priorities for you if you're confirmed to this position at HHS?
Well, Senator, thank you very much for this question. And I would like to thank you so much, you and your staff, for all of your work on these very important issues. I am a pediatrician in my original field, and I still have a pediatrician's love for children and adolescents, and will do everything possible to work for the betterment of children and adolescents in our country. Mental health, as I mentioned in my opening statements, has been really that intersection between medical issues and mental health issues has been really one of the bases of my career. And I look forward to bringing that experience that I have in academic medicine and at the Penn State and the Pennsylvania Department of Health to my role if I am confirmed as the Assistant Secretary of Health. And I would very much like to look forward to working with you and your office and your staff, since I know that you have done a lot of work in this area.
Dr. Levine, thank you. Dr. Murthy, I have a question for you based upon your work combating vaccine hesitancy and the culture of prevention you've often spoken of to reduce the burden of preventable illnesses related to diet or exercise or isolation or vaccine preventable disease. To your credit, you've worked with others on these goals, reaching out to employers, faith-based leaders, even partnering, as Chair Murray mentioned, Elmo on Sesame Street to better reach families. When you co-chaired the Coronavirus Advisory Team, you collaborated with Dr. Marcella Nunez-Smith, who is now leading the COVID-19 Equity Task Force, working to reduce disparities related to the pandemic and assure equitable allocation of resources, including the vaccine. We're now fortunate enough to see a light at the end of this terrible dark tunnel we've been in. The vaccines are helping us prevent disease and death. If we have all the information we need and trust so that more of us will make the decision to take the vaccine when it's our turn, if that happens in greater numbers, we'll all be in better shape. As Surgeon General, how will you use your leadership and the full force of the Public Health Service to address this issue of vaccine hesitancy so the people of our country can establish the trust they need to take the vaccine?
Well, Senator, thank you for raising this important issue. You know, I think we have seen concerning rates of vaccine hesitancy when it comes to the COVID-19 vaccine. And what I would seek to do if I had the privilege of serving is, number one, seek to understand directly by listening to people, by showing up where they are, what's driving their concerns. And it's different. I think we can't assume that the same issues are concerns for everyone. We can't assume there's also one size fits all solution to vaccine hesitancy. We got to understand what people's concerns are, and then we have to bring the best of science to address those questions the best we can. But Senator, I also think that we've got to do this in partnership with local communities. I learned from my past experience as Surgeon General that one has to approach the task of communication with humility, recognizing there's a lot we do not understand, and that people on the ground, faith leaders and educators and doctors and nurses often know far more about what their communities need and what their concerns are. So we've got to listen with them, work with them, and together I do believe that we can help reduce rates of vaccine hesitancy.
Thank you. Thank you, Chair Murray.
Thank you very much. Senator Paul.
Genital mutilation has been nearly universally condemned. Genital mutilation has been condemned by the WHO, the United Nations Children's Fund, the United Nations Population Fund. According to the WHO, genital mutilation is recognized internationally as a violation of human rights. Genital mutilation is considered particularly egregious because, as the WHO notes, it is nearly always carried out on minors and is a violation of the rights of children. Most genital mutilation is not typically performed by force, but as WHO notes, that by social convention, social norm, the social pressure to conform, to do what others do and have been doing, as well as the need to be accepted socially and the fear of being rejected by the community. American culture is now normalizing the idea that minors can be given hormones to prevent their biological development of their secondary sexual characteristics. Dr. Levine, you have supported both allowing minors to be given hormone blockers to prevent them from going through puberty, as well as surgical destruction of a minor's genitalia. Like surgical mutilation, hormonal interruption of puberty can permanently alter and prevent secondary sexual characteristics. The American College of Pediatricians reports that 80 to 95% of prepubertal children with gender dysphoria will experience resolution by late adolescence if not exposed to medical intervention and social affirmation. Dr. Levine, do you believe that minors are capable of making such a life-changing decision as changing one's sex?
Well, Senator, thank you for your interest in this question. Transgender medicine is a very complex and nuanced field with robust research and standards of care that have been developed. And if I am fortunate enough to be confirmed as the Assistant Secretary of Health, I would look forward to working with you and your office and coming to your office and discussing the particulars of the standards of care for transgender medicine.
The specific question was about minors. Let's be a little more specific since you evaded the question. Do you support the government intervening to override the parent's consent to give a child puberty blockers, cross-sex hormones, and/or amputation surgery of breasts and genitalia? You have said that you're willing to accelerate the protocols for street kids. I'm alarmed that poor kids with no parents who are homeless and distraught, you would just go through this and allow that to happen to a minor. I would hope that you would have compassion for Kira Bell, who's a 23-year-old girl who was confused with her identity. At 14, she read on the internet about something about transsexual. She thought, well, maybe that's what I am. She ended up getting these puberty blockers, cross-sex hormones. She had her breasts amputated. But here's what ultimately she says now. And this is a very insightful decision from someone who made a mistake but was led to believe this was a good thing by the medical community. I made a brash decision as a teenager, as a lot of teenagers do, trying to find confidence and happiness, except now the rest of my life will be negatively affected, she said, adding that the medicalized gender transitioning was a very temporary, superficial fix for a very complex identity issue. What I'm alarmed at is that you're not willing to say absolutely minors shouldn't be making decisions to amputate their breast or to amputate their genitalia. For most of our history, we have believed that minors don't have full rights and the parents need to be involved. So I'm alarmed that you won't say with certainty that minors should not have the ability to make the decision to take hormones that will affect them for the rest of their life. Will you make a more firm decision on whether or not minors should be involved in these decisions?
Senator, transgender medicine is a very complex and nuanced field, and if confirmed to the position of Assistant Secretary of Health, I would certainly be pleased to come to your office and talk with you and your staff about the standards of care and the complexity of this field.
Let it go into the record that the witness refused to answer the question. The question is a very specific one. Should minors be making these momentous decisions? For most of the history of medicine, we wouldn't let you have a cut sewn up in the ER, but you're willing to let a minor take things that prevent their puberty, and you think they get that back? You give a woman testosterone enough that she grows a beard, you think she's going to go back looking like a woman when you stop the testosterone? You have permanently changed them. Infertility is another problem. None of these drugs have been approved for this. They're all being used off-label. I find it ironic that the left that went nuts over hydroxychloroquine being used possibly for COVID are not alarmed that these hormones are being used off-label. There's no long-term studies. We don't know what happens to them. We do know that there are dozens and dozens of people who've been through this who regret that this happened and a permanent change happened to them. And, you know, if you've ever been around children, 14-year-olds can't make this decision. In the gender dysphoria clinic in England, 10% of the kids are between the ages of 3 and 10. We should be outraged that someone's talking to a 3-year-old about changing their sex. I can't vote for you if you can't
Thank you
make a
so much,
decision.
Senator Paul. Senator Levine, thank you for answering the question. I will turn to Senator Baldwin.
Thank you, Chair Murray. And I want to welcome Dr. Murthy and Dr. Levine to the Help Committee. It's good to see both of you again. I want to turn our attention, perhaps not turn our attention, we've sort of been speaking about this already, but to the issue of health disparities, which I know both of you have worked to address throughout your careers. Back when I served in the House of Representatives on the Energy and Commerce Committee, we had a series of hearings on health disparities. These hearings were shocking and perhaps part of the early stages of us as a Congress trying to tackle health disparities that exist. And I'm recalling in multiple hearings where we would have a panel of expert witnesses talking about the health disparities that exist, talking about possible ways to diminish these disparities. And I would often ask this panel of government experts or academic experts, what can you tell me about health disparities affecting the LGBTQ community? And the response I would often get is stammering and muttering and we'll have to get back to you. The Institute of Medicine ultimately did a very profound study on gaps in knowledge and a set of recommendations to how to close these gaps in our knowledge about health disparities impacting the LGBTQ community. Dr. Levine, based on your experience as a state health official, what should the federal government do to support state and other efforts to better prioritize and address the health needs of people in the LGBTQ community?
Well, Senator Baldwin, thank you so much for your question, and thank you so much for your work on this issue. Health equity is a critical aspect of our approach to COVID-19 and really to all health issues. COVID-19 has certainly shown us the challenge in healthcare disparities that we see in our nation, and that would include the LGBTQ community. In Pennsylvania, we have had an annual LGBTQ health assessment, which has given us very important data about the community. In addition, we are the only state that is collecting sexual orientation and gender identity data in terms of COVID-19 testing. And I think this brings up the point of the importance of data. It is critically important that we include questions about sexual orientation and gender identity in our data collection. That would include many studies done by Health and Human Services and the CDC. And I think that as we get more data, then we understand more about these health disparities, and then we can develop the appropriate policies in order to address them.
Well, I really appreciate that. I want to pivot to the opioid and substance use disorder epidemic. It's certainly one of my top priorities, and it's also a top priority for many members of this committee on both sides of the aisle. Unfortunately, the ongoing COVID-19 pandemic has exacerbated challenges in our response, and I'm deeply concerned about reports of data of increased overdoses and other harmful effects of this crisis. This is to both Dr. Levine and Dr. Murthy. As Surgeon General and Assistant Secretary for Health, what would you prioritize in our response to the opioid and substance use disorder epidemic, including to make up for lost time, lost ground over the past year?
Well, Senator, thank you for this question. It is very, very important. The opioid crisis has been with us for a number of years, and it has worsened, as you mentioned, during the COVID-19 pandemic. In Pennsylvania, and as Physician General and Secretary of Health, I concentrated on this. We worked on prevention, on rescue with naloxone, and an expansion of treatment, particularly medication-assisted treatment. If confirmed, I look forward to working with Dr. Murthy and SAMHSA and other experts on making sure that we fully address the opioid crisis.
Dr. Murthy?
Thank you, Senator, for that question. The issue of opioids and the opioid crisis is certainly near and dear to my heart. It's an issue that I focused a significant amount of attention on when I was Surgeon General last time. And as a clinician, as a doctor, I cared for many patients in Massachusetts and in neighboring states, including New Hampshire and Maine and Rhode Island, who struggled with issues related to opioids. I think in the 2016 report that I issued on alcohol, drugs, and health, I had laid out a number of steps that we can take as a country, not only to address opioids, but the larger crisis of addiction. But I still feel that there is important work we have to do, given exactly what you said, that overdose deaths have not gone down. In fact, they have gone up, especially over the last year. And I think we still have more we can do to expand access to naloxone. We still can take steps to expand access to treatment, not only making medication-assisted treatment more available by integrating it into primary care, but by making it easier also for clinicians to prescribe to their patients when they feel it is needed. But I also, Senator, feel that we can do more to invest in prevention. We detailed in the 2016 report a number of programs, including school-based programs, that provide an extraordinary return on investment in terms of reduced healthcare costs, economic losses, and criminal justice costs, with relatively modest upfront investments. I think a lot of those programs are still not well known. They're certainly underinvested, but these are places where I think a little investment can go a long way and can ultimately help save lives.
Okay, thank you very much. Thank you, Senator Baldwin. Senator Collins.
Thank you, Madam Chairman. Dr. Levine, we had a very good discussion prior to this hearing, covering a host of issues ranging from COVID in nursing homes to the need to get children back to school to the opiate crisis that Senator Baldwin just touched on. I want to follow up on two of those issues with you. And I want to read to you a statement that was made in an op-ed that appeared recently in the Washington Post by some public health experts. They said, quote, "At some point, we have to recognize the consequences of keeping millions out of school for a year and treat this like the national emergency that it is," end quote. And I could not agree more with that statement. About half of the K through 12 students are out of school even as we meet today. Studies are showing that low-income children in particular are falling behind academically. We've seen an increase in suicides and mental health problems due to isolation. Social development is being set back. There are very real consequences of children not being in schools, not to mention the extraordinary stress it is placing on many parents. In this op-ed, public health experts suggested that 3 feet of distancing from student to student while keeping adults 6 feet from everyone else would be sufficient to allow many classrooms to reopen. Similarly, the American Academy of Pediatrics, and I know you're a fellow of the Academy, has said that, quote, "schools should weigh the benefits of strict adherence to the 6 feet spacing rule with the potential downside if remote learning is the only alternative." I would like to ask you very specifically what you will do to help us get our children back to school, and whether you think that there are ways to safely accommodate, including looking at this recommendation for only 3 feet of spacing, which is a major obstacle now.
Well, Senator, thank you very much for your question. And I very much enjoyed our conversation the other day about this and other issues. I think everyone agrees, and certainly as a pediatrician, is that we need to do everything we possibly can to have children safely go back into the classroom, and that it is very, very important. A number of weeks ago, the CDC did put out guidance regarding schools, and of course, this is a local issue. In Pennsylvania, of course, we have local control, so as the Pennsylvania Department of Health, we had put out guidelines, but it ultimately was the decision of the superintendents and school boards about whether their learning would be remote, hybrid, or in person. But I have had the opportunity to read the articles that you mentioned and review the American Academy of Pediatrics statements, and I found them very interesting. And if I am fortunate enough to be confirmed to this position, I would very much like to work with others at Health and Human Services, to work with Dr. Walensky at the CDC and look really closely at this issue.
Thank you, because there are a diversity of views of how we can safely open schools, and we're really seeing the downside of not having them open. We also talked about COVID in nursing homes, and you assured me that Pennsylvania did not do what New York did, that it accurately reported. However, I am told that in September of 2020, Spotlight Pennsylvania reported issues with inadequate disclosure of cases and deaths in nursing homes. For example, some facilities were consistently listed as having no data in the weekly state reports, yet at least one provider, which operates 5 facilities, said that they did respond with information. Do you still stand behind your statement to me that the data were accurately reported?
Well, Senator, thank you for that question and the opportunity to clarify this issue. I do stand behind my statement. Pennsylvania was always completely transparent in terms of our data, in terms of COVID-19 deaths in nursing homes, as we were in other data that we reported. What you do have to understand is that there is a lag time from the time that a tragic death would occur to the time that it hits our electronic death reporting system, and then we would report that death. And that lag time can be sometimes days, but sometimes weeks. And so a nursing home might have had a death, but it wouldn't have hit our system for several weeks later, and then it would be recorded in terms of our data. So that lag time explains the Spotlight PA report.
Thank you.
Thank you very much, Senator Collins, and we will turn to Senator Kane.
Thank you, Chair Murray and Ranking Member Burr, and to our nominees, congratulations on your nominations. You know, I think I'll just start here. I think the U.S. response to COVID-19 will go down in history as the worst failure of domestic governance in the history of the United States. And I feel very emotional as I say those words. There have been some failures in the U.S. on foreign policy issues that have been notable ones, but in the sense of domestic governance, I cannot think of a worse one. This is now the 3rd most deadly event in the history of the United States, just a single event. Spanish flu, 675,000 Americans died. Civil War, 620,000 Americans died over the course of the war. We're now north of 500,000 and climbing, more deaths than the entire World War II, for example. So many of these deaths were unnecessary if you measure the United States against the experience of other nations, and set aside nations that are communist nations that have a command and control over citizens that a democracy doesn't, but just use democratic nations, our peers in the OECD or in the G7, and look at their experiences. And if you just wanted to average them together and say, if we had done what they had done, hundreds of thousands of fewer deaths. In the last couple of days, Dr. Fauci said that no nation handled this worse than us. And we're a nation with the best healthcare institutions in the world, the best healthcare providers in the world, an industrial base that, when pressed under warp speed, did an amazing and miraculous job of producing a vaccines, multiple vaccines that work. We've had healthcare providers on the front lines who have just been unbelievably heroic. We've got Virginia guardsmen and women from other states who were out doing the testing and then out again doing food bank distribution, and they're out right now doing vaccination. So many people to be proud of, but how did a nation like this, how did a nation like the United States find ourselves in a position where we have led the world in deaths at such an untold scale? It really just started, in my way of thinking, there were a whole lot of things that caused it, but it started with a big lie, perpetrating that this was going to go away, that it wasn't anything we needed to worry about. We've learned that a president with a microphone has the loudest voice in the world, and that voice can be used for good or evil, but the big lie that was perpetrated at the beginning of this, together with other errors like the CDC mistakenly deciding not to use the WHO test protocol and then developing a faulty protocol on their own that had to be scrapped, this put us in this horrible situation. I'm very emotional about this. I know 9 people who've died of COVID. Last time I checked, the nation of Taiwan only had 9 deaths. The entire nation, right across a narrow strait of water from China where the virus originated. I think if we're not willing to sort of acknowledge that, look in the mirror, then we're not going to be prepared for the next one. And one of the things that I'm excited about both of you, your nominations, is you have a track record that can help us prepare for the next one. I have colleagues who are very focused on trying to do a 9/11 commission to analyze the events that happened here on January 6th. We need a commission that will analyze why the U.S. got the pandemic wrong. That's much more important. Senator Collins, you and Senator Menendez had a bipartisan bill to do that, which that should be a pressing need for us to analyze what went wrong in the pandemic, because there will be another one. And when there is another one, we have to show that we're wiser and able to deal with it. Dr. Levine, I want to ask you a particular question. I was a little worried at the beginning of the Biden rollout of sort of a COVID response team that I didn't see enough people who I thought had state-level experience. As a former mayor and governor, I love doctors, I love academics, I love people at think tanks, I love the brainiacs, but I really love the implementers. Because what happens in a situation like this is everything we do has to survive the reality test of being able to be implemented at a state level or in a city. Talk about your state level experience and what that does in terms of adding to the team so that we can both fight our way out of COVID, but then ensure that the nation never falls down so badly on a job as we have in the last year.
Well, Senator, thank you very much for that question. Thank you for your passion about this subject and for public health. COVID-19 certainly has been the biggest public health crisis that the country has seen in 102 years, and it has taken an enormous toll on our country, and with over 500,000 deaths. Each death is a tragedy, as you've been pointing out. I think that this pandemic has shown the importance of public health like nothing else possibly could, and that would include local public health, state public health, and federal public health, and most importantly, the collaboration and coordination between all different aspects of public health. You are correct. As the Secretary of Health in Pennsylvania, under the governor's leadership, I led Pennsylvania's response in containment and mitigation, and then distribution of medical countermeasures such as medications, remdesivir, monoclonal antibodies, and the vaccine. If confirmed to this position, I would very much like to take that experience in operationalizing the federal initiatives and the federal guidelines and strategy really at the state and local level, and I hope to make my contribution that way.
I'm over my time. Thank you for indulging me, Ms. Chair Murray and Ranking Member Burr.
Thank you. We will turn it over to Senator Cassidy.
Thank you. Doctors Levine and Murthy, I could ask either of you my questions, but I'll start with you, Dr. Murthy. Dr. Murthy, health equity is something that we must all be concerned about. I spent 25 years caring for patients in a public hospital for the poor and uninsured. And so that, as you might guess, particularly means something to me. That said, when I hear some people speak about it, it sounds as if it is something to stoke resentment, as if any health inequity must reflect injustice. Now, all three of us are physicians, and so I just want to explore this because I think it's important. Are there biologic or scientific reasons that make somebody more susceptible to dying if they contract COVID virus? And of course there are. The older someone is when they get it, the more likely they die. Up to, if you're over 85, you are really have a high death rate. But Dr. Murthy, could you suggest some of the other comorbidities, medical conditions that if they're present can be associated with increased morbidity from mortality from COVID infection?
Well, Senator Cassidy, thank you for that question, and it's good to see you today. I enjoyed our conversation a few weeks ago. I think you're right that the origins of the disparities that we see in health are complicated, and with COVID in particular, why some communities are experiencing worse outcomes than others. Some of that we understand, but we are still learning about that. It's a complex product, I believe, of the environment, of biology, of pre-existing structural inequities in our system, which make it harder.
Specifically, though, what are some, I have limited time, specifically, what are some of the medical comorbidities associated with worst outcomes? Because if we don't make the diagnosis, we're docs. If we don't make a diagnosis, we're doomed to fail in terms of the treatment. And so I guess I'm just exploring if you thought about this, which I'm sure you have, but could you be a little bit more pointed to answer my question?
Sure, Senator. Well, fortunately, the CDC has noted a number of conditions that do increase the risk of poor outcomes with COVID. Obesity is one of them. Cardiac disease is another. We know that some pre-existing lung conditions as well can do the same. We know diabetes.
Can I ask you, thank you, and again, I'm sorry, I just have limited time.
That's okay.
Are these medical conditions generally distributed through the population, or are they more likely to occur in some groups of Americans as opposed to other groups? How do you want to define that, socioeconomic or however?
Sure. Yes, they are not evenly distributed, Senator. They are disproportionately distributed in the population.
So if such a group which has a disproportionate representation of such a comorbidity has worse outcomes, that's important to know, because if all we do is assume it's injustice, and there may just be an increased prevalence of obesity, then our diagnosis is flawed. It may be partially true in one instance, but not true in the other. To the degree that it's not true would negatively affect our ability to effectively address. Is that a fair statement?
Senator, I think you're correct that we have to look clearly at the data and understand what it's telling us. And I think that this is where I think science has to lead us as we make the diagnosis, as you put it, and also as we formulate solutions for how to address the disparate outcomes that we see.
Yeah, I agree with that. And so if we are going to talk about health inequity, it's important not to just stoke resentment, but to acknowledge that there is a biologic basis for why some do worse than others. For example, some people are older, and then recognize that, frankly, as however we can address it, obviously can't affect age, I wish we could, in order to have the appropriate treatment. Then let me ask you both. I'll ask this to Dr. Levine. If obesity is a major risk factor for heart disease, diabetes, hypertension, gallstone disease, many of what I just listed is associated with a worst outcome. Is it fair to say the federal government should be doing more to address the epidemic of obesity?
Well, Senator, thank you for that question and bringing up the issue of health equity and health disparities. In terms of your specific question, we certainly need to concentrate on the prevention and treatment of obesity, and as a pediatrician, particularly childhood obesity. But I also think that when looking at COVID-19 healthcare disparities, that we have to look also at the social determinants of health, which are critically important in terms of influencing health outcomes from COVID and many other conditions.
I agree with that. We do need to look at social determinants of health. If we look at somebody and we control for social determinants, but nonetheless they were obese, had hypertension and diabetes, do we think, are you telling me that the social determinants would overwhelm those medical risk factors? Or do you think that the medical risk factors would be more important in determining somebody's outcome?
I think all of those factors would be important.
Yeah, but that's not what I'm asking, Dr. Levine. I'm asking to rank them, please. And I don't mean to be rude, but I'm out of time and I'm about to get called down. How would you rank them?
I don't think it's possible to rank them, sir. I think that they're all involved.
I yield back. Thank you, Dr. Levine. I yield back. Thank you.
Thank you, Senator Cassidy. Before I turn it over to Senator Murphy, I do want to say, Dr. Levine, I wanted to say I appreciated your thoughtful and medically informed response to Senator Paul's questions earlier in the hearing. It is really critical to me that our nominees be treated with respect and that our questions focus on their qualifications and the work ahead of us, rather than on ideological and harmful misrepresentations like those we heard from Senator Paul earlier. And I will focus on that as chair of this committee. So thank you again for your response. And with that, I will turn it over to Senator Murphy.
Thank you very much, Madam Chair. Let me associate myself with your remarks. Thank you for for the way in which you handled those questions. Really looking forward to working with you, Dr. Levine. Have two sets of questions for both of you, one for each, excuse me. Dr. Murthy, I wanted to talk once again about this issue of vaccine distribution. I know there was some conversation about vaccine hesitancy earlier. I convened a conversation in Connecticut last week to talk about vaccine equity. And I received a significant amount of pushback from the folks around the table when this conversation came up about hesitancy, right? Many of them felt like that was an effort to blame communities of color for a problem that has, I think, potentially been created through the design of how we have administered the vaccine. When you create a sort of first come, first serve vaccine system, you disadvantage those who work 2 or 3 jobs, who have trouble taking a day off work in order to make the one appointment that's available. I heard a lot about just a lack of information, that when you don't listen to people about where they get information, that you end up with broad sectors of the population, especially those maybe who don't have English as the first language, not having basic information about when the vaccine is available. And so when we have this conversation about equitable distributions of vaccines, I want to make sure that we're building systems that meet people where they are, rather than just looking at these numbers where in Connecticut we have incredibly low rates of African Americans and Latinos who are taking up that vaccine and say, oh, well, that's because those populations don't want it, or we have to convince them why it's important. A lot of it, I think, is that the design just makes it harder for communities of color, low-income communities to be able to access it. How do you respond to that critique?
Well, Senator, it's good to see you, and thank you for that question. Look, I think that you're highlighting a critical issue here, which is that vaccine hesitancy is complex and not solely experienced by members of racial minority groups, but there are many groups in society right now that at some level are concerned about vaccines, and we have to recognize that and understand that their reasons for hesitancy are different, because that will inform our response. But the distribution, you're right, the disparities we often see with vaccine distribution are often related to pre-existing structural challenges that we have, one of them being a lack of access to healthcare that many people unfortunately face. And if we want to, not only with COVID, but with future potential pandemics, have a system that can respond well, we've got to ensure that we have community health centers that can actually distribute this vaccine. And this is why CHCs are such a powerful part of our healthcare apparatus. We've got to be able to quickly stand up mobile units to bring the vaccine to where people are. And we also have to ensure that we are establishing community vaccination centers strategically in locations where typically it's hard for people to access these vaccines?
Thank you. Appreciate that. I think so much of our conversation in this subject is around this question of hesitancy. It's an important one, but we have to be talking about systems as well. Dr. Levine, I and a group of my colleagues have been pushing really hard to have specific money set aside in the COVID package for summer programming, and summer programming for kids that is centered on their emotional well-being. I, as a parent of 2 school-age kids in the public school system, neither of which have set a foot inside their school, have been doing full distance learning for the last year, I really worry about our kids' emotional health. I know we've talked about that already today. We've seen suicide rates increase, emergency visits skyrocket. And this summer, I really think we've got to work on emotionally resetting kids, getting them reconnected to their peers so that they're ready to learn. This is your field of specialty. What's your sort of broad sense of what kids need right now? Where should our focus be on making sure that kids are emotionally healthy once schools sort of fully reopen and get back to normal in the fall?
Well, Senator, thank you for this question. I particularly enjoyed our discussion about this a number of days ago. Certainly, the mental health needs of children in our country right now are at the forefront. Pediatric and adolescent mental health has been part of my career in academic medicine and at the Pennsylvania Department of Health, and I think COVID-19 has certainly exacerbated those mental health issues and mental health needs. I was really quite taken by your idea in terms of summer programming. And if I am fortunate enough to be confirmed to this position, I would very much look forward to meeting with you again and your staff and working on this issue and see what we can do to actualize it.
Great. Well, thank you very much. Thank you to both of you for your willingness to continue your service to the country. Thank you, Madam Chair.
Thank you. And I believe that Senator Marshall is next on the Republican side.
All right. Thank you, Chairwoman. Appreciate the time. Welcome, Dr. Murthy. Good to see you again. Dr. Levine, good to meet you in person as well. Appreciate your time with the Doc Caucus 4 years ago and hope you'll come back and visit us. My question, I'll let you both answer it. You know, we talk about the goal of the current administration is 100 million vaccines in 100 days. Today, we've already got 85 million vaccinations out the door. We should be able to be doing 2 or 3 million vaccinations a day. We have the infrastructure, as you all know, to do 3 million flu vaccines per day. And I'm trying to get how you both think, because you're going to be offering advice and goals, and is it feasible? But I would think that we could do 3 million vaccinations a day in March, get us up to 150 million people vaccinated by the end of March. I think 25–50% of people have had the vaccine or have had the virus already. And my theory is we could have herd immunity by April or May. Is that possible? Is it feasible? What type of advice would you be offering to the president and the team that's working on this? And maybe like a 30-second answer, Dr. Murthy. What's your advice as the potential Surgeon General?
Well, thank you, Senator. And it is good to see you again as well. I love the spirit of what you're asking, which is how can we think bigger? How can we do better? How can we move faster? And what I would seek to do if I was serving as Surgeon General, sir, is work with the administration to understand how we can expand capacity for distribution. One of the reasons we have the ability to distribute so much flu vaccine is we've engaged primary care providers in that network. And if we get more of our fellow physicians engaged in their offices and distribution.
Why are we reinventing the wheel? That's just it. The backbone of the vaccinations are doctors' offices, community health departments, and pharmacies, right? Why do we need to reinvent the wheel? Let's get the vaccines in their hands.
Yeah, so I think we can get more vaccines into pharmacies. I think especially with the Johnson & Johnson vaccine potentially coming on, that would be easier to store for clinicians in their offices and ultimately get into patients' arms.
Dr. Levine, any thoughts? Your advice?
Well, Senator, thank you for that question. I mean, certainly we need to do everything we can to ramp up the vaccination program as much as possible. I think the president has an excellent strategy, an excellent vaccine program to be able to accomplish that. They are having vaccines go to pharmacies through the vaccine program, as well as to federally qualified health centers, as well as vaccine clinics. but we do need to make sure that we get vaccines into arms. We also need to take into account the health equity issues that we were discussing before to make sure that we target vulnerable populations such as the African American community, the Latino community, and rural communities.
Of
Make
course,
sure they have access.
of course. With the new big news saying that the the vaccines we're using already are 75, 80% effective with one shot, what type of advice would you be offering to getting, a greater number of people vaccinated right now as opposed to getting that second shot into the same person's arms? Dr. Murthy?
Well, Senator, I thought that was really interesting data. And I think that because of the way the trials were done with the two-dose model, while I think that is the foundation we should use, we should absolutely be quickly seeking to study what that one-dose model could look like, or a delayed second-dose model. And if the data holds up that people achieve sustained protection, not just for the first few weeks, but sustained protection, then I think that's a model that we absolutely should examine. I think science really has to guide us here. We've got to collect the data, get the knowledge, and then implement it in our policy.
Dr. Levine, any other?
Well, I would agree. I think that we need to stick to the two-dose model now for the Pfizer and the Moderna vaccines, because that's how the studies are done, but then study other models to see if they could be effective.
But you said we're going to follow the science, and the science says one shot is 80% effective. If our goal is to get herd immunity, why wouldn't you try to get more shots into more people's arms? Still prioritizing people the age of 65, people with health care problems, et cetera. But why wouldn't you follow that science?
Right now, the FDA approval recommends 2 doses. I think we need to look at the science that you're discussing and have more studies to that regard. But I also share everyone's enthusiasm about the Johnson & Johnson.
So you think following the FDA guidelines is a good idea as well. Last question on kids in school. I want to know what your opinion is. You follow the science. American Academy of Pediatricians says kids can go back in school. What is your opinion? Should kids be back in school now?
Well, we certainly want to get children back in school as quickly as possible, Senator. The CDC has spoken about that, but I am interested in the American Academy of Pediatrics literature that you're referring, and if confirmed, I look forward to collaborating with Dr. Lewinsky.
But you don't have a recommendation? Is that a goal? Is that your goal? You think that kids should be in school now? Is there not enough science to say that kids should be in school yet?
I think that we all want children to be in school in a safe way, sir.
But Dr. Murthy, I mean, what is your opinion? Is there enough science to say that kids should be in school now?
Senator, I do think we have a growing amount of data that tells us how to get kids back in school safely, and tells us that if kids are masked, if they're distanced, if we have good ventilation in schools, that we can actually do a pretty good job of reducing transmission in school. And on top of that, if we can get teachers vaccinated, if we can get testing in schools, that can even further reduce the risk.
I'm out of time, but I certainly want to publicly thank all the teachers that are in school, that are out there. We're focusing on the ones that aren't, but I'm so grateful for the teachers that are out there on the front line teaching, and just want what we can do to empower them to get our kids back in school. Thank you, and I yield back.
Thank you very much. We'll go to Senator Smith.
Thank you, Chair Murray and Ranking Member Burr, and thank you so much to Dr. Levine and Dr. Murthy for being with us today and your willingness to engage in public service, particularly in this way, which is just so important to our country right now. As Senator Kaine said so powerfully, we are in the midst of a tragic loss of life and a pandemic that has totally upended our economic and our health and our sense of well-being. And I know that you both understand this, and so I'm just doubly grateful for your willingness to serve in this way. I'm always reminded of something that a Minnesota farmer said to me earlier last year. He said, when it comes to COVID-19, we're all in the same storm, but we're not all in the same boat. And I think that this gets at the ways in which COVID has magnified the inequities that already existed in our society. So I'm so grateful for your willingness to serve. Dr. Levine, I also want to say how much I appreciate the dignity and the professionalism that you demonstrated in your response to Senator Paul as a physician and as a public servant. And I want to be really clear that this is a moment where we should be focusing on the grave challenges before us. And one of these challenges is that LGBTQ+ people have long faced discrimination and barriers to healthcare. And they are much more likely than non-LGBTQ+ people to lack access to insurance and to affordable medical care. We need advocates at all levels to make sure that we address that inequity and that we fight against discrimination and ensure that everybody, all patients, have access to care, especially amid this crisis, which has revealed so many inequities. So I wanted to thank you. Dr. Murthy, when you and I spoke, we had a great conversation about the listening tour that you did when you were Surgeon General the first time. And you talked about how you went out and you expected to hear people's concerns, health concerns, and you instead discovered this theme of Americans feeling lonely and isolated. And we talked a little bit about this broad-based social isolation that is happening right now amongst older adults, amongst kids that are not able to be in school, amongst so many people. And this is something that I know we both care a lot about because of the direct impacts that social isolation can have on people's health. This lack of social connection is not just about being lonely, it is about the direct impact on people's long-term health outcomes. So Dr. Murthy, could you talk a little bit more about this and maybe say a bit about how you expect to continue to work on the issue of social isolation, what we can do in Congress to help, and how we can incorporate some of these ideas into our thinking about healthcare?
Senator, thank you so much for that question. And I really enjoyed our conversation on that topic of isolation and loneliness as well. This was one of the unexpected things for me that came up during my service as Surgeon General. I expected when I began my listening tour to understand what was on the minds of Americans, everywhere, that I would hear about issues like obesity and substance use and depression and anxiety. And I did hear about those concerns. But what I heard so often were stories of loneliness and isolation from not just elderly individuals who are living alone, but I heard them from college students on crowded campuses, from moms and dads, from teachers, from doctors and nurses, and even from some members of Congress who told me behind closed doors that they too struggled with loneliness. These stories resonated with me because I had seen so much loneliness in my patients, patients who would often come in by themselves, and even in the moments of extraordinarily difficult, hard decisions about treatment, we would have to have that conversation alone with them because they had no one who could come in and be a part of that conversation. And I also experienced a lot of loneliness as a child. So that the experience is very, very raw still and present in my mind. But what was concerning to me as Surgeon General were the health consequences also. The fact that the increasing body of data showing that loneliness is associated with an increased risk of premature death and heart disease, as well as other conditions like depression and anxiety. There is a lot we can do, starting with communities. Faith organizations, other community organizations have a powerful role they can play in helping to stitch together the fabric of a more connected society. Clinicians, doctors and nurses can also play a powerful role in surfacing issues like loneliness, which are unfortunately stigmatized and which people struggle with but don't feel comfortable talking about. And finally, government does have a helpful role it can play too. When government chooses to name an issue as important, when it convenes people to come together and build a strategy to address an issue, it can have a powerful effect on moving the needle on the actions we take. We've seen that with opioids and with other issues. So this would be an issue I would love to work on with you and with other members of Congress. It affects people all across our country and has significant health impacts.
Thank you very much, Dr. Murthy.
Thank you, and we will turn to Senator Murkowski.
Thank you, Madam Chairman. Dr. Murthy, it was good to speak with you some weeks ago. I appreciated that. Dr. Levine, I look forward to our conversations as well. In my conversation, Dr. Murthy, we talked about the disparities that we see in our rural areas. Know that, again, that will continue to be a pressing issue for me. I just came from a gathering of Arctic parliamentarians by way of Zoom, and one of the things that we were focusing on in our discussions was what we are seeing in the Arctic nations, not only during COVID, but prior to COVID, and these are the issues of mental health, just general behavioral health issues, and our reality that during this pandemic, we're seeing rising levels of substance abuse, we're seeing rising levels of suicide, particularly amongst our youth. And I raise this again to ask your commitment, your focus to not only mental health in a pandemic, at a time of global pandemic, but really moving forward and how we can address these mental health needs in areas where we already have disparities with access to all kinds of medical services. So if you can speak very briefly to the mental health as it relates to substance abuse, suicide, and some of the other, again, very troubling realities that we're facing right now.
Well, Senator, it is good to see you again as well, and thank you for that question. The issue of mental health broadly is obviously deeply concerning. It's an issue that I've dealt with as a clinician, that I've seen as a Surgeon General. But the impact in rural communities in particular has been heartbreaking. I had a window into the disparities that exist in rural communities through my father, actually early in life. He grew up in a small village half a world away in India. But interestingly, many of the stories he told me hold true in America, that rural areas often have disparate access to healthcare as well as to education and economic opportunities. And when I was Surgeon General, Senator, when I visited Alaska, when I'm Nepaskiak in particular, when I visited Oklahoma and other rural areas, I saw firsthand that those disparities were real and that the access to mental health care through telehealth, the ability to have access to providers as well in person was often far reduced in an environment where we just didn't have sufficient access to resources. One of the things I would love to do if I have the privilege of serving is to work with you and to work with other senators to see how we can close the gap that exists in rural communities when it comes to mental health care by providing not only better telehealth and telemedicine, but also by working to strengthen our workforce of mental health providers, which are often in scarce supply. And I believe we can do that in part by investing in community health centers, which are a backbone of communities all across this country, but which can help provide mental health resources as well.
Well, and as you know, the significance that they play in providing for care in Alaska throughout our state. I want to ask you about homelessness as a public health issue. We see growing areas of homelessness in my state, and it's a pretty tough place to be homeless, particularly this time of year where it is cold and it's going to be cold for some time forward. But we're seeing this in so many areas of the country. My view is that there has been little focus on our public health authorities to research, to implement evidence-based, comprehensive strategies to address what we're seeing with regards to homelessness. I think we're going to see more homelessness as a result of this pandemic. In your role, if you are confirmed as Surgeon General, what do we need to do to be raising the awareness, to be not only becoming more aware, but actually working to address these, I believe, significant health issues as they relate to homelessness?
Well, Senator, I'm glad you raised this. Of all the social determinants that we talk about with regard to health, housing and homelessness is one of the most powerful. It was something I saw firsthand as a doctor. I remember, Senator, one of the first patients I cared for who was homeless. I was a medical student at the time. And I remember talking to the patient as they were being discharged about the medications they needed to pick up from the pharmacy and the 3 follow-up appointments they needed to have. And at some point, I realized how foolish I was, because their primary concern was where they were going to sleep that night, and all those other issues of when they were going to follow up in 3 weeks with cardiology were secondary and less likely to happen, unfortunately. I believe there's a powerful connection between housing and health. I think there's a growing body of data that tells us that. I think part of what we have to do is make sure that data and that science is clear and evident to the public and to policymakers. But when I was Surgeon General last time, Senator, I also worked with HUD, with Housing and Urban Development, on, in that case, a program and an approach to reduce exposure to secondhand smoke. That was just one example of how housing and health go together. And I would welcome the opportunity to do that again, to engage with HUD and with policymakers to see how we can put roofs over heads, how we can reduce homelessness, recognizing that can improve health outcomes as well as people's overall experience.
Well, I'd love to work with you on that. I would recognize, though, that through HUD, that is one avenue, obviously, to address the issues of homelessness, but so many are these invisible homeless that are in our community, particularly our children, our families, and whether or not whether or not HUD is best able to respond to these issues of kids who are couch surfing, who are technically homeless, what the structure is to best address them. I'm over my time. I appreciate that, but this is a conversation I would love to follow up with.
Well, thank you.
Thank you, Senator Murkowski. Senator Rosen.
Thank you, Madam Chair. I want to thank both of the doctors here today for your willingness to serve, your thoughtful responses. You know, I know being a doctor takes both intelligence and empathy, and I believe that the two of you possess both those important characteristics, so I appreciate you being here today. I want to have a question for each one of you. Mental health concerns, K through 12 kids, mental health concerns for seniors. So to both of you, tragically, Nevada has seen an increase in youth suicides throughout the pandemic. In our Clark County School District, 18 students have taken their lives in just 9 months. Sadly, we are the highest in the nation. The pandemic also has been particularly hard on seniors. They're most vulnerable to the virus. We've talked about the social isolation, the tremendous toll that it takes. In Nevada, we have roughly about 370,000 seniors, and 25% of those estimated to live alone. So to Dr. Levine, I'll go first. I want to build upon Senator Murphy's question, a little bit on Senator Murkowski's question. Given what's happening in Nevada, you have extensive experience addressing youth mental health needs. How would you address the disturbing trends in youth suicides, mental health problems? I know that you've had programs and public and services in Pennsylvania that helped out with the students. And so what would you do for our youth experiencing suicidal thoughts?
Well, Senator, thank you so much for that question. I enjoyed our conversation a number of days ago very much about this and other issues. Clearly, mental health issues among our youth it remains a significant public health problem. As you had pointed out, in my career in academic medicine at the Penn State College of Medicine, I saw many troubled children and teenagers, some of whom were suicidal and required intensive treatment to treat some of their underlying mental health issues and other issues that were leading to those concerns and their suicidal ideation. I participated in a suicide task force, suicide prevention task force, as part of my role as the Secretary of Health in Pennsylvania. And if I am fortunate enough to be confirmed to the role of Assistant Secretary of Health for the nation, I look forward to collaborating with SAMHSA, collaborating with Dr. Murthy and other content experts, and then working with you on making sure that we can address this issue, which has just become exacerbated during the COVID-19 pandemic.
Thank you. Next, I'd like to address the senior issue. So Dr. Murthy, you know, many seniors, they really continue to isolate in their homes. And as you suggest, senior health needs, we really have to think about the connection they have. They're missing people. They're missing that important touch. Now we have COVID. We're not even allowed to hug people. We don't get to be close. And that isolation is so devastating. It causes a lot of depression and other kinds of health issues that follow that. So can you talk about the importance of the social things that we can do, investing in maybe meal programs, some kind of home visits, check-ins, or those things that serve seniors, particularly in our rural areas where it might even be hard to get people out there?
Well, Senator, thank you for that question. And I think you've touched on an issue that is that is painful, frankly, for many families, which is the experience that seniors have of being lonely and isolated, especially during this pandemic, which I think has worsened that isolation for many of them. I think, Senator, I don't think it's often well appreciated in the general public just how profound an impact that isolation and loneliness has on health. And I think that's one place where a Surgeon General, I would hope to bring some attention, is just to the fact that social connection and loneliness is important, not just so we can feel better, but so we can do better in terms of our health. But I think second, there's a powerful role that community organizations can play. You know, so often I find, and I found this was true when I was traveling the country as Surgeon General as well, that many organizations, because they don't have primary expertise in health, they think that they can't do anything to improve health outcomes. But organizations that can connect young people with the elderly for visits, that can provide food or resources to the elderly, that can simply call to check in on people who may be living alone, they can play a powerful role in helping people feel more connected in difficult periods of their life. So addressing isolation that seniors experience, this is an all-in challenge that, yes, does require government attention, but also it requires communities to be engaged and recognize that they have incredible power when it comes to helping their seniors. But this is an area where I would love to certainly focus on with you and with your colleagues.
No, I appreciate that. I know in my home community, there's groups at our university, there's groups in our faith-based community that have just created these phone trees to call and check in on people. That was something everyone could do during the pandemic. So you're right. Sometimes there's a grassroots solution to help for some of the problems. Thank you. I've gone over my time. I appreciate you both being here.
Thank you very much. Senator Braun.
Thank you, Madam Chair. During the whole COVID challenge, my observation has been, especially coming from the business world so recently, in a place like Indiana, where I think we did a pretty good job with the navigation through the whole process, maybe didn't take so much a one-size-fits-all approach, differentiated a little bit by counties within the state. I thought that was something we should have done, and I think it did unfurl that way. I got a few questions about what you were able to do in your home state. The idea that you treat all counties the same, both rural and urban, to me didn't quite make sense. And have you actually looked at the results of the approach that was taken in your state in terms of that trade-off between fighting the disease itself and the economic impact that would be concomitant with it if you took an approach that was going to be too draconian, that didn't make sense? Have you been able to get through the data to see, are you happy with the way you handled it in your home state?
Well, Senator, thank you very much for that question. I appreciate our discussion about this and other issues a number of days ago. With this novel coronavirus, COVID-19, in the spring, there are basically three tools in the public health toolbox in order to address it. One is containment, which involves testing, contact tracing. The second is mitigation. At its heart, mask wearing and social distancing and washing hands, but also some of the closures that you're discussing. And then the third are medical countermeasures, including medications and vaccines, which of course were not available in the spring. Testing was also not particularly available in the spring. We had lack of personal protective equipment, so it was quite a challenging situation in the Northeast and in the Mid-Atlantic. So mitigation was one of the biggest tools in the toolbox that we could use. Pennsylvania actually did take, under Governor Wolf's leadership, a very sequential, iterative approach in terms of the business closures that we did. We did go county by county in terms of whether the businesses would be closed or not. And eventually the entire state did get closed, but it did go in that iterative approach. We also took a sequential iterative approach in terms of reopening with a red, yellow, green schema that did go county by county.
And then have you actually done any metrics or compared, where's your unemployment rate currently in your state?
Well, sir, I actually don't know the current unemployment rate.
I think you'll find if you look across the country that there's a direct correlation. You look at a place like Florida that got a lot of heat early on, figuratively speaking, ends up having the most vulnerable population. And you did have an approach there where I thought it took a dual perspective of trying to keep the disease at bay, respected for all the peculiarities it's shown us, but also with the most susceptible population has done a good job when you look at doing both. What about, very quickly, how has your vaccination rollout gone? Have you been pleased with the performance of getting vaccinations out in your state?
Pennsylvania, like many states, initially had significant challenges in terms of the rollout of the vaccine over the holidays and then into January, et cetera. Of course, I left the Pennsylvania Department of Health in January, so I've had no contact with the Pennsylvania Department of Health and don't really know what exactly differently they're doing now. I think Pennsylvania has had successes and has had challenges in terms of their vaccine rollout, but things are continuing to improve.
Thank you. Dr. Murthy, just a question to the point. Do you think guns present a public health emergency?
Well, Senator, I think that gun violence, like any other form of violence, is a concern to me as a doctor who's taken care of many patients who have been the victims of violence. But I think the way we approach that issue, Senator, should be driven by science. I'm grateful that Congress has, on a bipartisan basis, put funds to study the origins of gun violence and how best to address it. But I'll tell you that my focus, Senator, is not on this issue. It is, and if I'm confirmed, it will be on COVID, on mental health, and on substance use disorders. These are the issues which I think are front and center in this moment. It's where I would put my attention, if confirmed.
You know, it's about out of time, but since we've gone through and it looks like the healthcare crisis is, thank goodness, ebbing with the results we're seeing, this is an issue that I'm sure will come to the forefront, and I'll get with you later on that subject.
Okay. I look forward to it, Senator. Thank you.
Thank you. Senator Lujan.
Chair Murray, thank you so very much to you and to our ranking member, Mr. Burr. Thank you for this important hearing. Dr. Levine, it was a pleasure visiting with you recently. And Dr. Murthy, I look forward to our conversation. Dr. Murthy, understandably, the federal government has focused the bulk of its resources on slowing the spread of the COVID-19 pandemic. However, we have simultaneously addressed the secondary impacts. We have to get this done of the pandemic, including a reported increase in opioid overdoses. As Surgeon General, you are considered the nation's doctor. How will you guide discussions and scientific investment so that individuals who live with acute or chronic pain can get appropriate treatment, including non-pharmacological treatments such as physical therapy, and also, if they do need pharmacological treatments, that they're non-addictive?
Well, thank you, Senator, for that question. I think you're raising a critical issue here, which is how do we treat pain appropriately, given how many Americans are living with some form of chronic pain. I cared for many of these patients. When I was practicing medicine, I know just how that pain can affect not only the quality of life of an individual, but their family as well. And I think what we have an obligation to do is to take what research currently tells us, which is that there are multiple strategies for addressing pain that are effective. They include physical therapy, cognitive behavioral therapy, and yes, in some cases, pharmacologic therapy with medicines. And we have to make these treatment strategies available to people. But right now, many people don't have access to physical therapy or cognitive behavioral therapy at the level that they need to help address chronic pain. And even when it comes to medications, these decisions have to be tailored based on a patient's individual situation. And there's not a cookie cutter, one size fits all approach that we have to take here. That's why we've got to empower clinicians with the right knowledge, with the best and latest data, so they can make good decisions with their patients to help ultimately address their pain.
Appreciate that, Dr. Murthy. Dr. Levine, we had a chance to visit about mental behavioral health, and you've been asked that question by several of our colleagues today. It matters to all of us across the country, especially in rural communities. So I'm interested in what we can count on with your advocacy to increase access to mental behavioral health. And then also a project that you're familiar with and that our chair has championed in Project ECHO and telehealth and telementoring, what your thoughts are with how we can expand those programs and also ensure that there will be reimbursement for both telehealth and telemodeling and mentoring services.
Well, thank you, Senator, for that question, and I particularly enjoyed our discussion about this and other issues a number of days ago. Clearly, mental health issues are going to be forefront as we work through the pandemic and afterwards, and this would include mental health issues for children and adolescents, as we have spoken about previously, but also adults and seniors, as was talked about as well. This is a particularly difficult issue in rural areas where there is lack of access to mental health services. And so I think telehealth is going to be very, very important, and that includes telepsychiatry and telepsychology. Of course, as we discussed, broadband is often critical. Access to broadband is critical to that success. I did want to highlight the program we talked about, which is called Project ECHO, which was founded by Dr. Aurora in New Mexico, and I know that you actually know him, and I've had really the fortune of meeting him. There is a Project ECHO program in Pennsylvania, which is spearheaded by the Penn State College of Medicine and Penn State Hershey Health. And they have been using that particularly for the opioid crisis and expansion of medication-assisted treatment, but also other medical issues and mental health issues. And I think that telehealth and programs such as Project ECHO need to be further expanded. And if confirmed, I look forward to working with you and other content experts and Dr. Aurora on expanding it.
I appreciate that. Dr. Murthy, populations that live in rural regions of the United States face unique challenges in accessing health care. These barriers contribute to the rural-urban divide, a phenomenon that leaves rural Americans with lower life expectancies than their urban counterparts. I believe everyone deserves access to high-quality, affordable care no matter where they live, what health insurance they have, or how much money they make. One of the first areas I think we need to address is the current caps and other limitations on rural residency programs that have put rural America at a disadvantage. Dr. Murthy, how can we work together to address the shortage of health providers in rural areas and increase federal support for rural residency programs?
Well, Senator, thank you for that question. I do think that we have critical workforce shortages in rural areas, and those include primary care shortages, but also specialists. And I think programs like Project ECHO, which I had the privilege of visiting in New Mexico when I was Surgeon General, are programs that can actually help to close that gap to some extent. But we have to do more because virtual care, while critical, is only part of that solution. We need to train more clinicians and bring them to rural areas. And we can do that in part through expansions of the National Health Service Corps. We can do that, actually, I believe, by also better utilizing the U.S. Public Health Service Commission Corps, which I was privileged to oversee as Surgeon General, which as it is, provides a lot of care in rural areas, but certainly is poised to step up and do more. So I do think that there are ways we can do this. And with residency programs as well, I think we can strategically work to train residents and place them ultimately in rural parts of our country that are in desperate need of medical providers. I would certainly love to work with you on this issue. I think healthcare providers get into healthcare wanting to relieve suffering and to serve. I think the areas that so often need service are rural areas, but they're not getting the providers that they need.
Thank you for the time today, Chair Murray.
Thank you very much. We will now turn to Senator Romney, who I understand gets the Patience Award today for sitting there. Senator Romney.
Seem to be able to get there. My mic goes on. The light doesn't, but the mic does. Thank you for being here today, and appreciate Senator Murray you giving me this opportunity. Dr. Levine, are there school districts that are open in Pennsylvania and some that are closed?
Well, Senator, thank you for your question.
We're short on time. So are there school districts, some open, some closed?
There are some school districts which are remote and some school districts which are in person.
Okay. Has there been a public health analysis to see those that have been open? Has there been a massive spread of COVID that's different than those that have stayed hybrid or all remote?
I'm not aware of that analysis, but
Okay,
yes.
If that's my impression as well, which is across the country, we've had some school districts open, meaning kids going to school, others absolutely closed, kids only going on remote. The evidence doesn't show so far that those that have been having kids in classrooms are seeing a spike in COVID cases. There are also countries that kept their schools open. They haven't seen a spike in COVID cases. I don't understand why our schools are still closed. There are some of us who feel it's a submission to the teachers' unions. And because they're such big donors to the Democratic Party, that the administration is saying, oh, we're not, at state levels, at the federal level, we're not going to push to get our schools open. But, you know, grocery store workers are working, drugstore workers, taxi drivers, EMS workers, healthcare workers, but there's just as much a priority for our kids to be educated. And I just can't understand why, given the fact that the data doesn't show that there's a problem for teachers or for families having kids going to school, we got to get our kids into school. The administration is proposing $170 billion going to education as part of the 1.9 COVID program, but only 5% of that is getting spent in this year. 95% is for years down the road. It has nothing to do with getting our kids safe and our schools open again. I just, I don't understand why the administration does not directly encourage all of our school districts to open again. And if we're going to send out $170 billion, which I don't support, but if we're going to send out $170 billion, it ought to be linked to them agreeing to get their doors open and get the kids back in the classroom. That's my chance to make a point, and hopefully you'll take that point to the administration in the responsibilities you have. Let me ask a question of Dr. Murphy, and that is, you've had concern, as I have, about kids vaping. And the analysis shows that about 1/4, I guess, of high school kids are vaping on a regular basis tobacco products, and in many cases marijuana as well, particularly at the higher grades for marijuana. What can we do to get the flavored vaping products off the market? That's what kids are getting into. This has been slow rolled by the prior administration. I think the prior administration was so concerned about the vaping shops and the adults that wanted to use the flavored products that they slow rolled this. But how are we going to get vaping products that are flavored off the marketplace so we don't addict our kids to nicotine?
Well, Senator, thank you for that question. And it is good to see you. You were my governor in Massachusetts when I first moved there for medical training, so it's nice to see you in person.
I take full credit for that.
Thank you. Listen, I share your passion for this subject. When I was Surgeon General, I issued the first federal report on e-cigarettes in youth, and I still am deeply concerned that while we have seen some improvement in numbers, that there are still millions of children who are exposed to nicotine through vaping. I think that while we've taken some steps, especially at a state level, to restrict access to youth, and while we have laws saying that kids shouldn't be using this, that there are still a lot of loopholes through which kids are accessing, e-cigarettes. And I also worry about the advertising, Senator, especially online advertising, which is an easy way for these companies to get their products to kids. So if I have the privilege of being confirmed, I would certainly look forward to working with you and with the administration on ensuring that we are taking steps to protect our kids from advertising, to enforce these types of rules. And even though the Surgeon General doesn't have policy-making authority, I do think that there are parents that I encountered all across this country who are concerned about exactly what you said, about why are their kids using nicotine-based products. And so this would be an area I would love from a public education standpoint to work with you on. I think there's a lot of progress we've made, but so much more we've got to do to protect our kids.
I appreciate that, and I know that part of this process is typically some throwaway lines that we all use, which is look forward to working with you on something, but then we never see each other. But this is one I really do care about, and I really hope that you'll be able to work with the administration and the FDA, that obviously has regulatory authority in this regard, to say, guys, you've got to push this faster. We've got to move ahead. The analysis paralysis that goes on in government is something which the private sector could never abide. And we have to get this addressed because it is a public health emergency. I'm sorry, Dr. Levine, my time is up. I couldn't get you to respond to that as well. But thank you. Madam Chairman, back to you.
Senator Hassan.
Thank you very much.
Let's try that. Better.
Better.
Thank you very much to our chair and to our ranking member and to our nominees. Thank you for your service. Thank you for your continued willingness to serve. And thank your families for us too, because it is a joint commitment, I understand. I wanted to start with a little bit of a follow-up. Senator Lujan asked you about the opioid epidemic, and this is a question to both of you. The COVID-19 pandemic has exacerbated what already was a devastating mental health and substance misuse crisis in our country. I'm encouraged that you both have knowledge and experience in combating the opioid crisis through expanding access to substance misuse treatment and services and working to diminish the stigma that is still too often associated, in particular, with heroin. Dr. Levine, as Secretary of Health for Pennsylvania, you led the state's effort to combat the opioid epidemic for several years. Can you please speak to the importance of continued, robust federal funding for states as we work to turn the tide of the opioid epidemic?
Well, Senator, thank you so much for that question. I appreciated our discussion about this and other topics tremendously a number of days ago. You are entirely correct. The opioid epidemic, the opioid crisis and overdoses continues. It has been exacerbated during the COVID-19 crisis, and we have to continue to address this robustly. In Pennsylvania, we worked on prevention with a concept I call opioid stewardship, with opioid prescribing guidelines, a robust prescription drug monitoring program, et cetera, rescue with the medicine naloxone, and then expansion of treatment, particularly medication-assisted treatment. And we do have to get past the stigma associated with that. All of those programs required funding. We needed funding for our prevention efforts. We needed funding for naloxone and for further distribution of naloxone. And then we needed funding for treatment. One of the programs we founded was called Pennsylvania Coordinated Medication Assisted Treatment, a hub and spokes model funded by the SOR funding. And so if confirmed, I look forward to working with you, with the rest of the members of Congress, and with SAMHSA on continuing the absolutely essential sustainable funding for the opioid crisis.
Thank you very much. And Dr. Murthy, if confirmed, how would you use your role to combat the opioid crisis and address the challenges in that crisis that have been exacerbated by COVID-19?
Well, thank you, Senator Hassan, for that question. You know, I think the opioid epidemic continues, unfortunately, to be a dire crisis for our country. I think that there are a few things, if I was confirmed, I would look to focus on, building on the 2016 Surgeon General's report that we issued on alcohol, drugs, and health. One would be to continue to focus on public education, recognizing that there is still an extraordinary amount of stigma around the opioid crisis, which prevents people from coming forward and getting help. The second thing that I would look to do is to take some of the core recommendations around treatment, particularly access to medication-assisted treatment, but also integration with primary care, and work with policymakers to see how we could advance treatment. And third, I would say, is to focus on prevention. Senator, in that report, in Chapter 3, we actually laid out a number of prevention programs which have been proven to work, to be cost-effective as well, to return far more dollars in terms of reduced healthcare costs, criminal justice costs, and economic productivity losses than the initial investment in those programs. But those are still not well known, and they don't always often receive the investment they need. So those would be a few areas that I would love to focus on with regard to addressing the opioid crisis.
Thank you for that, and I look forward to working with both of you on it. I want to turn to a different question, Dr. Murthy. Even as we expand access to COVID-19 vaccines, we face the continued risk of additional spread within communities and the emerging threat of new COVID-19 variants. Experts have been clear one of the best ways to bring an end to the pandemic is to continue to wear a mask in public, avoid indoor gatherings, and maintain social distancing. Dr. Murthy, given the pandemic fatigue many people are understandably experiencing, how do you plan to use your platform to ensure that Americans continue to adhere to public health guidelines, even as vaccinations continue, until we're really truly able to get the virus and its variants under control?
Well, Senator, it's a great question, and I think, to be honest, a lot of us are experiencing the fatigue from the pandemic. I certainly, am as well. I know a lot of us have been struggling for the last year, although, many certainly much harder than, have had much more difficult experiences than others. I think there are a couple things that I would seek to do, Senator. Number one, I think we do need to be consistent in our communication around the value and the importance of masks, and we have to follow. We have to lead by example in demonstrating that they work and they're important to wear. But the second thing I think is recognizing that fatigue is real, and it's not, I think, a reason to judge people. It's real. We're human beings. We're tired. That means that the faster we can also get people vaccinated, the more quickly we can return to a state where we can see each other, where we don't have to distance, where we don't have to wear masks all the time. And that's why I would also focus my efforts on the vaccine, on getting it to people, making sure people understood clearly what the benefits and are, so that they can make good decisions for themselves and their families.
Well, thank you for that answer. Thank you to the chair and ranking member. I will also just add that I would love to work with you and Senator Romney and others on the vaping issue, because I think people are not understanding the connection now we're seeing between teenage vaping and cigarette use later in life. And I very much look forward to working with both of you on that. Thank you.
Thank you.
Senator Tuberville.
Thank you, Mr. Chairman. Thank you for being here today. Most of them have asked most of my questions. I'll try to make it short, make a little bit of a statement. I've been in education for 40 years. I've seen a lot of words put into protecting our kids from drugs, opioids, marijuana, all those. And we don't seem to do a lot about it. And I'm glad, Dr. Murphy, I heard you say something about education. And after 40 years of experience, that's what it's got to be done. We've got to put education, we've got to put money behind it. And it's getting worse and worse. Now that we've opened our borders, it's going to get even worse. And I feel for our kids. I really do. They're looking for something else, something different. Again, dealing with 17 to 24-year-olds for 40 years, it's different every day. But we got to find an answer. We got to find a solution, because it's not going to get any better by just saying it'll go away on its own. We're losing 50 to 60,000 kids a year dying of overdose. And we talk about COVID, and it's our biggest problem now, but we have to do something. Now, I live in Alabama. We've lost 14 rural hospitals in the last 10 years because we're losing nurses and doctors. We don't have enough hospitals to take care of our patients. Dr. Murphy, for you, other than telemedicine, which we're using, what can we do? The thing about it, the only thing we have now in our rural areas is our pharmacies. And now those are starting to go under, because, if you think about it, that's really our hospital and our doctor and our consultant for healthcare in rural areas. But these PBMs are absolutely putting our pharmacies under, because they're the middleman between the drug companies and the pharmacies, and they're taking all the profits. But what else can we do in the rural areas?
Well, Senator, I think this is such an important point, and I realize that the challenges that you're speaking to in Alabama are likely being experienced in other rural areas in our country too, that you're struggling without enough healthcare providers, and they're watching rural hospitals close down as well. There are a couple of things, Senator. In addition to telehealth, which you mentioned, the couple other areas I think we need to focus on is on strengthening our rural health workforce, where we see often clinicians get trained and then they relocate or stay in urban areas, and we don't have enough nurses and doctors in rural areas. But we can address that, I believe, through a combination of the National Health Service Corps, using the United States Public Health Service Commission Corps more effectively, and expanding their role. I think we can do more there. But the other place where I think we can do more, Senator, is in supporting the rural hospitals themselves. I think the cost structure in rural areas, as you know, is different for healthcare than in urban areas. And you have to sometimes put more into base infrastructure to serve a smaller population, because that is the nature of rural areas. If we apply a one-size-fits-all model to rural and urban areas, then rural areas will come up short, and they won't get the support that they need. I think we've got to recognize that and build that into our funding support models as well.
Yeah. Thank you. Dr. Levine, you've worked in mental health. And of course, being a football coach and an educator, I worked in mental health for 40 years because I see a lot of it. You know what I'm talking about. And we seem to be, over the last 10, 12 years, more and more problems with mental health with our young people. What do you think is the answer to that? I mean, what's the first direction in your job would be to overcome some of that?
Well, Senator, thank you for that question. We do share a concern about young people and their mental health. And at Penn State Hershey Medical Center, I ran the adolescent medicine program where we saw many young people with medical issues as well as mental health issues. I think that, that we need to work on prevention and we need to work on access for treatment. I think we need prevention programs to prevent mental health problems in our schools. I think we need prevention programs in our communities and community health centers as well. And I think we need to increase access to treatment, whether that's in urban areas, suburban areas, or rural areas. We need more mental health professionals. We certainly need more child and adolescent psychiatrists, but not only psychiatrists. We need psychologists, psychiatric social workers, and really the whole spectrum of mental health workers to be able to treat our young people who are suffering from these mental health issues.
Basically, what you're saying is we need a plan.
Yes, sir, we need funding.
We need funding, we need a plan, and I've never seen that in mental health. In all my years in being around kids, you know, we had to look for somebody to help with mental health problems. One other question, Dr. Murphy, you've been through this job one time. What's your number one priority that you feel like that you can do better at this time?
Well, sir, I have had the privilege of serving once before, you're right. And the reason I'm back, Senator, is because my priority first and foremost is to address COVID, to turn this pandemic around. There are issues that have been worsened by COVID, mental health and substance use disorders. And those are my accompanying priorities as well. But we've got to turn this pandemic around first and foremost. Sir, to me, this is very personal. I've lost 7 family members to COVID. Most recently, my uncle in Dallas a few weeks ago. I look at my children, you know, who are, my older one, my son, is doing remote learning as well. Desperately wants to be back, you know, with other kids, but can't. And there are many families I know that are struggling much more than we are. I want those families to be able to get back to their lives. I want our kids to be able to get back to school. I want people to be able to go to work and not worry every day that they're going to catch the virus and get sick. I want us to be able to come together as a community again, Senator.
Yeah.
That's what's brought me back to public service. It's why I hope to have the opportunity to serve our country once again.
And both your jobs are very important. And COVID is, I've lost friends. It's sad what we've gone through. We can see the light at the end of the tunnel, but we've seen drugs and mental health problems just continue to soar. We have to put money in education. Dr. Levine, I think Levine will agree with me on that. We have to do something about it. We can't continue to say it'll go away. COVID, hopefully, we will get it to go away. These other two, they're not going anywhere. And it's all about educating our kids at a young age, and not starting when they've already had a problem. Thank y'all today. Thank you very much. Thank you, Mr. Chairman.
Thank you very much. Senator Burr, I will turn it over to you for closing comments.
Thank you, Chairman Murray. And I want to thank our nominees today for your time, for your personal stories, and for the expertise that you bring to the nomination. Senator Murray, I would like to ask unanimous consent this time to put into the record, even though I don't have it in my possession while I sit here, the latest high school data relative to marijuana use and to vape products. What I think that latest data showed was that in high school students, marijuana was used more than vape product. That vape product in that category by high school students, that the least used flavor was menthol. Today, menthol is the only flavor on the marketplace. All the rest of them are gone. And the decision by the last administration to allow menthol to remain was in hopes that those that use adults that use combustible products could make the transition off of combustible cigarettes to vape product as a way to fulfill harm reduction, which is the full intent of vape products and other cessation programs. So, Senator Murray, I would ask unanimous consent that when I can get that data today, I can put it into the record.
If you have that information, so ordered.
Thank you. Thank you, Madam Chairman.
Thank you so much. That'll end our hearing for today. Dr. Murthy, Dr. Levine, thank you both for joining us to talk about your experience and your thoughtful answers on how you will work with all of us to end this pandemic and improve health equity and make progress on so many other public health challenges. I'd like to thank all of my colleagues on the committee for participating in today's hearing as well. Given the urgency of this moment, I will be pushing to get both of these nominees confirmed quickly so they can hit the ground running, and I hope colleagues across the aisle will work with us to do that. For any senators who wish to ask additional questions of the nominees, questions for the record will be due by Friday, February 26th at 5 p.m. The hearing record will remain open for 10 days for members who wish to submit additional material for the record. We'll have a hearing on the ongoing response to COVID-19 pandemic soon. Details will be announced in the coming days. And with that, the committee stands adjourned.